We're delighted to have with us Ms. Maureen Louise Gallagher, the Chief Child Survival Development, the United Nations Children Fund, the UNICEF. Yeah. Thank you very much for being with us.
Thank you for having me.
Thank you. First of all, would you tell us your impression about the conference and the sessions that we have been attending?
Very impressed. So it's my first time attending the Congress and impressed by the setup, impressed by the theme. Human development is really foundational for economic development and progress in a country, be it at early years, school age years, teenage years, or adulthood. And I think to see sessions that do cover the full life course does acknowledge the importance of it throughout. For the sessions I participated in, have found it quite interesting how diverse the panels are, with looking at participation. Of course, the leadership of government and Ministry of Health and Population has done an exemplary job in organizing and bringing people together. But as well, UN organizations, different ones, civil society organizations, also community-based organization representation, and as well the private sector. So it's been interesting to see these different perspectives on a number of different topics, having attended on primary health care, on universal health coverage, and other sessions.
The UNICEF is quite well known by its programs and collaboration with the Ministry of Health and Population on several programs. And one of them is for sure primary health care. And you have been assisting in one of these sessions. Would you please give us a brief about the discussion that we held at that?
Yes, and yeah, very grateful to have been invited to participate in the panel on primary health care and the transformative approach, the transformative model of PHC that is being implemented in Egypt. And what makes it very interesting is it looks at the approach and the model in different dimensions. How in a primary healthcare unit there is management of a unit, so there's operational guidelines for that. There is the health unit itself and the importance that there are integrated services available across maternal, newborn child health, nutrition, well-being, so psychosocial support as well, and others. And as well to see now the next step, which is really reinforcing an already existing system of outreach and ensuring that we can reach every child and every adolescent through this, what we'd say maybe could be the family counselor plus community health worker team, outreach team, to really reach all governorates and the most vulnerable and most rural, hard to reach areas in the country. So in the next 2 years, we'll be working together to capacity build and to develop the skills of these community health workers and of family counselors, reaching 27 governorates and over 32,000 family counselors and community health workers. So through a network, so having a hospital, the health facility, and the community through an integrated package, and also to be able to bring access to information, so through digital systems, I think we'll be working together to make the impact that is already there even more impactful and reaching even more people in the country.
Perfect. Ms. Marie-Louise Gallagher, thank you very much for joining us and for all the informed knowledge that you have been sharing with us.
Thank you, and congratulations, because it really has been, at least I'm very impressed and I'm learning a lot. In a way, it's been a briefing on everything that is happening and so much that's being done and achieved. Thank you.
Thank you.